I'm here today with Roger Severino, Director of the HHS Office for Civil Rights in Washington, D.C. Roger, thanks for joining me.
Glad to be with you.
And I would like to kick off and talk a little bit about the OCR's priorities for 2019. If you could kind of walk us through what are the key priorities for the agency.
We just issued a regulatory sprint towards coordinated care, which included a request for information that just closed. We received over 1,300 comments from the public. And when I say coordinated care, let me give you an example of what I mean. So my mother, for example, came over from another state, visited us, had a cough. We took her to the hospital. Things were fine. And I received the bill, which is interesting because I didn't request the bill. But then she had to go back to her home state. So now we have provider A here, provider B in her home state, and she also wants to change provider, so that's provider C. There's no guarantee that the information that she received from her doctor here is going to make it back to her home doctor or any future doctor. And that's an issue of coordinated care. So as part of our regulatory sprint, we ask questions. How could we use HIPAA to address this issue to make sure that patients are empowered with their own information? Now, under the HIPAA rules, a patient can request their own information. So my mom could actually ask the provider to get her own medical records, but then she would have to give that record to her doctor directly. So the question we asked is, well, isn't it possible, if we were to look at the question of provider to provider, can we say that provider A must provide the information to provider B at the request of the patient for the purpose of coordinated care? And under our current rules, my mom could ask for her own records at a patient rate reduced cost within 30 days, but that doesn't apply to provider for provider. So these are the questions we're looking at to make sure we make it as frictionless as possible to improve the coordination of care.
Now, why is this the right time to really tackle coordinated care? Are all the pieces in place for this movement to really progress?
Well, yes, this is a priority of Secretary Azar and Deputy Secretary Hargan. This involves more than just the Office for Civil Rights. It involves more than HIPAA. It involves anti-stark and kickback rules, price transparency, interoperability with the Office of National Coordinator. So the entire agency is working on this effort of coordinated care, on value-based care. The time is now because we need reform. This is a deregulatory environment. The president on down has said that we have to remove impediments to care. You'll see what the secretary is doing on drug price reform is a major part of the efforts to make sure that people get the drugs they need at the prices that are just and reasonable. So it's part of an administration-wide effort to make sure that such a tremendous part of the economy, which is healthcare, gets the focused attention it deserves, because at the end of it, we're looking for improved health outcomes for patients.
Now, I know you can't go too much into this request for information, but do you expect to have a proposal out this year, sometime this year, or later on, perhaps
that
late
is the
summer?
goal. There are various things we could do with the request for information. We could do regulatory action, guidance, and that's going to really inform all of our efforts based on the response we've gotten so far, which has been very encouraging. So we do have a goal of moving as quickly as possible to remove regulatory burdens. And in fact, we also are addressing the opioid crisis. This is another priority of this administration, of this secretary. As part of the request for information, we included requests about how we can best address the opioid crisis through the HIPAA rules. We've heard heartbreaking stories of parents losing their adult children to overdose and not knowing that their children were suffering. And there's a lot of myths around HIPAA. We've issued guidance to try to clarify that doctors are empowered to coordinate with parents following the rules appropriately guarding for privacy, but when it involves treatment, if there's incapacity, if there's a threat to health or safety, doctors are empowered to share information with parents, get them involved to help address the scourge of the opioid crisis. As part of the request for information, we're seeing if there are ways we can make sure that doctors who are acting in good faith in the best interest of the patients will get that additional level of protection to make sure that information gets out to the proper parties and that lives are saved.
Now, switching gears a little bit, I know you've talked recently about a switch in tactics at the OCR towards more enforcement, specifically with the right to access, that if a doctor is not providing the patient with medical records, there will be enforcement. And I think also in regards to the HIPAA audits, can you speak a little to how that's going to change?
Yeah, so you're referring to the right of access rule, where a person can request their own records and they have the right to get it. I went through this myself very recently. I asked for my lab results. I got an interminable runaround from my provider. And they're required within 30 days to provide a person their own medical records, generally in the format that they request, if it's reasonably accessible in that format. And we've seen that too often providers are not following the rules. We provide free training. We have a Medscape module. Go to our website. We've had 56,000 providers receive training It's free. You could get continuing education credits. We encourage providers to take advantage of this resource. It has not been enough. We're still receiving complaint upon complaint of people not getting their records or not getting it in a timely manner or being overcharged. Part of the rules, especially after the High-Tech Act, is that you cannot charge more than reasonable labor costs. We have a safe harbor of $6.50 per request. This is not being respected. And we're trying to make sure, again, that there is less friction in the system so that patients are empowered with their own medical information. Because sometimes this is literally an issue of life and death. And the more the information is put into the consumer's hands, the better health outcomes we're going to have at the end of this.
Right, and alongside the lines of the privacy audits, is that going to become less educational? I know that it was designed to say, if you're out of compliance, here's a way that we can help you. Is it going to focus more on, we're going to hold you up to the power of the OCR now?
Yes, we've learned a tremendous amount through the audit program. We've developed a list of best practices through this, and we're going to implement this now in an enforcement mode. I have an enforcement background. I was at the Department of Justice Civil Rights Division for several years, and I want to see the most egregious bad actors being held responsible. Under the current rules, if you have a breach of over 500 records, you're required to report within 60 days to the Office for Civil Rights. And I'm very pleased to see that much of the industry does comply with this self-reporting requirement. But there are some actors that do not comply. And when we find out about this, expect to receive an audit at the end of it. I want to make a distinction between the actors that are playing by the rules as best they can and those that are egregiously flouting the rules. If you're a bad actor, expect an audit to come your way, and if it takes regulatory action to follow up with this enforcement initiative, then that's what we'll do, but that's what I think we're going to be headed in the future. Another
component of the OCR I'd like to touch on is the conscience and freedom of religion, and I know that that's relatively new. Since the division was rolled out, how has it progressed? Have there been a lot of complaints coming in, and how is the OCR handling them?
This is going to be the lasting legacy of my tenure here. We launched a new Conscience and Religious Freedom Division at the beginning of 2017. And it has a very simple premise. The foundational rights of conscience and religious freedom deserve to be enforced at least as well as every other civil rights that we enforce. And taking that premise, we announced that we're in business, that the laws that Congress passed, some of which are over 40 years old, are going to finally get the attention that they deserve, that people who have been suffering, who have their rights violated, are going to be heard, and it's going to be addressed. And just for some numbers by way of contrast, previous to the election of President Trump, we were receiving about 1.25 complaints per year under our conscience authorities. Now we're receiving over 100 complaints per year. And this is indicative of a couple things. First, that we have announced to the world that we're going to take the complaint seriously, but that there's a real problem out there of entities flouting the law. We're very proud that earlier this year we issued our first notice of violation. This is a finding of violation against the state of California under the Weldon Amendment, which prohibits discrimination on the basis of somebody objecting to paying, referring, or performing abortions. And California passed a law, the FACT Act, which was struck down by the Supreme Court for violating the free speech clause. And we have issued a finding following that saying that you also violated the Weldon Amendment. You cannot target pro-life pregnancy resource centers who are trying to help women that are in need of options. These are nonprofits. The state of California went against them, discriminated against them because of their beliefs, because of their refusal to refer for abortions, and that was in violation of law. We issued that finding so you could consider it a guilty verdict with a suspended sentence because it's currently enjoined after the Supreme Court decision. So we're hopeful that other states will not follow suit.
Now, is that division, is that staffed with some of the HIPAA experts, or do they share resources? How does that work in terms of the infrastructure of the OCR?
They're different divisions. So we have three main buckets. We have health information privacy, our civil rights, and our conscience and religious freedom division. So that's the three enforcement tools that we have at our disposal. And we have a regulatory framework for the first two, and we've issued a proposed rule for the third. So again, to create parity with every other civil right with health information privacy, we want the same enforcement tools for conscience and religious freedom. We have about 25 statutes that we identified that Congress has passed over the decades protecting this invaluable right, and it deserves the enforcement tools. And we're very pleased to see a tremendous outpouring in terms of public comment, and we're getting very close to finalization of that rule.
Overall, OCR, do you face any budgetary pressures, or how is the resources that you have available? Are they enough for the job, or are you prioritizing?
Well, we are in a deregulatory environment. We are in a environment of fiscal responsibility. That is what we're doing. That's what the Secretary is doing. We're doing more with less, and we're succeeding at it. We've had the 2 most consequential years in OCR history. And we could see it in last year. We had a record-breaking number of settlements and collections under our HIPAA authorities, over $28 million, which was 22% greater than the previous record. We launched our new Conscience and Religious Freedom Division, and we're still getting positive results in our civil rights authorities as well. And right now we're getting over 28,000 complaints per year under all of our authorities, which is a lot of work, but we found new efficiencies and we're getting the job done to have this fantastic last couple years.
To wrap things up a little bit, I know that you mentioned that the 28 million, the record, that you'd like to see that number drop, as obviously there's more compliance. Do you expect that that trend is going to drop, it's going to lessen? Do you think the providers out there are kind of getting the message in terms of data breaches and HIPAA?
Well, the fact that we did hit a record by such a large margin makes it difficult to match records, but that's not the goal. And I've said this many times, I'm not looking for the most numbers, the most dollars we could get. What I'm looking for ultimately is that our enforcement efforts, our education efforts, our regulatory efforts are so effective that compliance is going to go up and the collections will end up going down. That means there are going to be less parties harmed. We won't have the anthem breach of 79 million people harmed because their records were exposed to the world. We have less of those cases and more compliance, and then we'll have the numbers go down. And that's the ultimate goal of really any enforcement operation. The civil rights side, conscience, religious freedom, and health information privacy.
It's really creating that culture of compliance where people from the top down really live it and breathe it in the organization.
Absolutely. It becomes a cultural shift, a cultural mindset, and that's what we're doing with all of our authorities.
Well, that sounds wonderful. Well, thank you so much. I really appreciate your time.
My pleasure. Thanks.